Welcome everyone to our introduction to LifeWave, the technology, a little bit about the company and the history. We get together every Tuesday evening to share a little bit about this very special company, the technology and the founder. Then we bring on one of our doctors after Gregory does a wonderful presentation, giving a nice summary and introduction. And then it's your turn. And you can ask questions, you can share stories. Please use the Q&A. I am your co-host this evening, Robin Blank Mascari, and I'm going to turn things over to the other co-host, my partner in every way, that just got a new haircut. Getting ready for Mexico, honey?
Yeah,
Okay, I'm gonna
very excited to take another out of the country trip to a warmer climate. Yeah, but very excited to be back home, but excited to meet with many of our team that are going to be with us down in Mexico on this wonderful awards trip. So I'm going to go ahead and share my screen again and kind of give a little overview of X39 and LifeWave and our genius scientist, inventor, and CEO, David Schmidt. So, but before we get started, I just want to share with you the aha I had a while ago. At this ripe young age of 69, I finally figured out what I want to be when I get older, younger. Okay. And I bet you many of you can relate to that. So, and before we get started, let me ask you a personal question. If you could wave a magic wand and anything were possible, what's one thing you'd choose to experience differently in your health or in the health of someone you love and care for? And what difference would that make for you or for them? Okay, think about that. And I do want to make note that our products are not designed or intended to heal, treat, or diagnose. However, get our bodies back into a more healthy, regenerative mode, and many times wonderful things begin to happen. So with that being said, let's talk about the stem cell revolution, because we believe everyone wants to look, feel, perform, and live younger. And stem cells are the key because they're a vital part of our immune system that actually repairs and regenerates damaged cells in all of our organs, glands, muscles, bones, everywhere throughout our body. Now, here's the problem and the sad news. The older we get, the less stem cells we have and the less active they are. And by age 60, only a small percentage remain. And that's a problem because the fewer stem cells we have, the faster we age and the slower we heal. And neither of those sound very cool to me. Okay, so what about stem cell injections? Because they become quite popular, but you know what? They're pretty expensive too. They can be painful, risky, controversial, and there's no guaranteed results. You could spend thousands or tens of thousands of dollars on stem cell injections, and you may or may not be satisfied with the results. Well, we've got some really good news for you here today, because you can look, feel, perform, and live younger with a historic breakthrough in stem cell activation. It's a new wearable technology in patch form. It's affordable, it's safe, non-invasive, it's drug-free. It's actually a patented form of phototherapy that I'm going to talk about in a little bit more detail. And probably our doctor will be addressing that also. But it uses specific frequencies of light to increase and improve our stem cell activity. And this is the brainchild of our visionary founder and CEO, David Schmidt, who's not only a brilliant scientist and researcher. Dave is also a genius inventor with over 100 patents and patent pendings. And he's been on the leading edge of phototherapy research and science for over 20 years. David's already conducted over 90 clinical studies proving the efficacy of LifeWave phototherapy products, and many more studies are in the works. And LifeWave itself is a 17-year-old advanced technology company focused in the field of health sciences. And it was started back in 2004 based on an energy-enhancing technology that David developed under a U.S. contract for the Navy SEALs to increase their strength, stamina, and performance without the use of drugs, stimulants, or caffeine. And it turned out to be so effective, it's now used by world-class athletes around the world in almost every sport. We have corporate headquarters, laboratory, and manufacturing diversified between California, Utah, and Ireland. And we have global distributions to 75 countries and 15 global distribution centers. And you know what? The word is getting out, because LifeWave patches are now used by professional and amateur athletes around the world in almost every sport. The medias begin to notice, and you know what? You might too, if you look careful and you see these auspicious little white patches, on some of the bodies of some of your favorite athletes. So how does this amazing technology work? Well, it's based on a type of light therapy called photobiomodulation. And LifeWave patches contain very specific combinations of organic materials and nanocrystals. And when they're activated or near our body, they're activated by our body heat, and then they begin to emit very specific wavelengths of light that stimulate targeted and beneficial biochemical responses in our body. This is known as photobiomodulation, and it is the basis of our LifeWave phototherapy patches. And now I want to say it's been a well-recognized and proven scientific principle for many, many years that specific frequencies of light can cause specific changes within the body. For example, when we go out in the sun, a specific frequency of light causes our body to make vitamin D. We don't get a vitamin D download from the sun. We get a download of a light frequency, and our body manufactures vitamin D. And it's the same for another frequency of light causes our body to manufacture melanin, the chemical that gives us a suntan. Well, LifeWave's patented technology is based on the same rock solid, widely recognized scientific principle. Our focus for the last 14 years has been in the field of anti-aging and regenerative science. And 3 years ago, we released to the global market the LifeWave X39 stem cell activation patch, which truly is a historic and affordable breakthrough in stem cell activation, because some are calling it the holy grail of anti-aging and restorative science, because we're actually doing what the multi-billion-dollar companies and big pharma have not been able to do. X39 actually activates a very specific copper peptide that activates our body's own stem cells, while also altering gene expression towards a younger and more vibrant you. So it is a game changer, and X39 activates our stem cells, and it's a true breakthrough. And David Schmidt, our founder, inventor, and CEO, says, "This is my greatest achievement yet," with emphasis on yet, because David still spends more time in the laboratory than in an office somewhere. So yes, we have patents. Yes, we have clinical studies. Yes, we have field results proving that X39 is actually turning back our biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very, very exciting news. So that's my part of the introduction presentation. And Robin, I'm going to, bow out and turn it back over to you to introduce our special guest doctor.
Wow, great job. Thank you, Lenny. That's a wonderful introduction of a very special company and technology. And I get to introduce our special guest tonight.
And you probably want to turn your camera back on.
Oh, okay. Is that better?
There we go. So this way we can see your haircut.
Well, I like yours better. So this evening, we always have one of our special practitioners, and tonight we have another one of them that we have these amazing practitioners in our LifeWave community. We have MDs, NDs, DCs, acupuncturists, nurses, massage therapists. They're drawn to this company for a very special reason. We have a product and a technology that is so unique, and more importantly, it works. It enhances the clinical outcome. So this evening, I get to introduce to you a very special man that has become a very special man in my life. He's classically trained as a neurologist, and he has expanded that in many, many ways. And he's a leading edge voice in neuroscience in the gut brain integrity. He's here to help educate people on the importance of healing our microbiome and really understanding the value of that. He has expertise in so many areas. He's an author. I like to call him an athlete of body, mind, and spirit. He is an absolute gift to our community. And I want to welcome Dr. Tom Acklin.
Thank you so much, Robin. Hi, good evening.
Hi. Where are you? We want to see you too.
Unable to start video because the host has stopped it. So maybe I'm audio tonight.
Oh, well, host, you want to give him a video?
Host, give me a video. Host with good hair. Host with really fantastical new haircut. Give me a video.
You are promoted to to host.
You should be able to come on video now so we can see your live. There he is. All right.
There we go. Hi, good evening.
Hi. So it must be cold over there too. It snowed here today.
It was 80 over the weekend and we had hail this morning.
Oh my gosh.
And
Oh
it'll
my
be
God.
80 again next weekend.
I don't think we have a patch for that.
We call it metabolic flexibility.
We have a name for it. I love it.
We have, if I could actually jump the gun, why don't I use that as a bridge? Because I
Go
noticed
for it.
a quick
Go for it.
question
Sure.
about a vascular problem. And this is Jerry's question. So a lot of what we do is we optimize the way the body interfaces with life. Yeah. And a lot of the early technology, David's work 20 years ago, was on capillary beds and endothelium, and the body's ability to neuroelectrically handle blood pressure changes and circulation changes, right? A lot of what we're seeing with the fragility of the linings of the blood vessels that's making the news these days is because people were fragile in the first place. Little critter came in, you know, whether that be, so something comes in that you don't recognize, you either shrug it away because you're metabolically flexible and you have the ability to come back to center, or you don't, right? So the thing that's the problem is always the pointer. And we do have, I know, let's talk about X39 first, but the answer to Jerry's question is yes, the interface, we actually have a technology. What's the one place we interface the planet the most, right? We feel a temperature change on our skin. We have a skin technology called Alavita. It's fantastic. It's not just for skin, it's for the linings, the ectodermal derivatives of all of the other tissues as well. So the linings of our respiratory tract, the linings of our gut, which is I'm passionate about, and so on and so on. And then we can talk about how the body mobilizes its repair as well, because this is a regenerative community, you know. To bring it back to center here, I love that you started by talking about how many different kinds of practitioners we have here, and committed practitioners who know that they're evolving their science and their therapeutic, are always looking for leading edge technologies and how to give a quantum leap, if you will. How do you get traction from the technology that you're already an expert at and give that to people?
I
And
love
think that great. Yeah.
Yeah. So you as a physician who proudly says you haven't prescribed medicine for people, I mean, pharmaceutical medicine in a very long time. What is it, Dr. Tom, that got you excited about LifeWave?
Well, I started getting excited about healing the body when I went to medical school, forgot about it for 20 years, right? And realistically, you know, and I'm not bad-mouthing the allopathic traditions, but that's not the game they play. We have this now, I think, very quickly eroding ideology that says the body is a machine, it's mature, and it degrades on schedule. That's old news. We lived with it for 50 years. We got lost. It's not true. The body's always, always, always regenerating. So it's funny. I was listening. I was listening to Gregory's talk about the frequencies and thinking each food actually brings a different frequency as well. And when we talk about a wide variety of foods, it's probably because we're trying to get as close to the total biophotonic spectrum of Mother Nature as possible. We don't think of it like that, right? But we probably have an inherent drive to do that. So I started studying food as medicine about 15 years ago. I realized people get well. Almost everything we have a disease for, you know, we call chronic disease is something that is reversible. You weren't born with it. It's an acquired condition. And what got me passionate was hearing other practitioners who were saying to me, at the time, similarly shocking things. Unfortunately, it's still a small percentage of people who speak that way, I think. Although that also is shifting because the powers that be have the microphones. So I've not traveled through the East, and I've not traveled, most of the world. I've traveled a lot of the world. But I think this is a very exciting time where practitioner groups like this, we can all call ourselves a practitioner group, are carrying a very exciting message. And I think we might see a quantum leap and realize that more people than not are speaking this language.
Beautiful.
And then what got me involved with LifeWave was I got excited because a friend of mine who I trust dearly called me, and I've worked with her professionally and I've known her for many years. And she told me about it, and I didn't have to look very deeply because it was her, right? And I said yes, that I'd take a look at it. I was kind of amazed that I'd not ever heard of LifeWave because I've worked with stem cell technologies before. But once I dug into the science and did my due diligence and started looking at all the clinical trials, successes, and then 75 countries were here, global success the past 2 decades for, as you pointed out in the opening, almost everything, surprising, shocking recoveries that people have had for a long time, right? And then we get to help them step into a new kind of capacity.
It's a very exciting technology because it is different and no one else has this. People have been, well, why don't you talk about, this very special technology with our, the star of the show is called X39, and it's a patch that, well, I have one right on my hand here that looks like this. It's about the size of a quarter, and it goes on your body. And could you tell people what it does? I mean, what's happening when this gets close to your body? It's activating this very special copper peptide, and we love everyone to do their own research. Could you just briefly share a little bit about why this is so unique?
Sure. Well, so all you have to do is just Google GHK copper peptide, GHK-CU. You might find something about LifeWave, but more likely you'll find a legacy of decades of research of people trying to chase stem cell upregulation technologies, right? It's the holy grail. We've known, again, kind of a fallacious dogma, but modern science believes that stem cells decline as we age, that you have a particular amount and then you hit 60 and they start declining. I think probably common wisdom is that once at 60, you have about a quarter of what you had after 60, you have on and on and on like that. So forward-thinking practitioners and scientists have been saying, how do we upregulate it? What if this didn't decline? And what do you know? David worked on a lot of different technologies with this very special photobiomodulation therapeutic, this dynamic. And 2 years ago, hit the home run, and X39 came along, and as effective as all of the other technologies that we have are, with X39, all of a sudden that regenerative capacity of the body, those pluripotent stem cells that can become anything they like, they can become any tissue, they can deliver repair capacity to any organ, and balance any imbalance. And all of a sudden, we have a way to bring up stem cells. And then all of the other technologies worked as well. So that's GHK copper peptide. And it's been known across all of regenerative medicine practices and all traditions that if we could do that, if we could find a way, we would have found the fountain of youth. And what do you know? David Schmidt came along and found it.
There we have it. So who is this product for and who isn't it for?
Well, it's for anybody who wants to feel life and in the world of bipeds, it's for anybody who feels great and wants to feel better. That was my situation. I saw breakthrough in my athletics. I saw breakthrough in my sleep that I really didn't expect. I started using these patches about 1.5 years ago. And you can imagine working in immune science that I was probably about as busy as I've ever been in my life last year, 1 year into this. And I was feeling great. I was working 18-hour days and feeling great. So it's for people who feel good and might not even know that they want to feel better, right? It's certainly for people who have been trying to feel better for a long time. And really, there's no condition. There are no side effects. So this is not a transdermal delivery. This is a non-invasive technology. And because nothing goes into the body, there are no side effects. There are only upregulation effects. The one group of bipeds that we say might want to consult deeply with their physician is somebody who's immunosuppressed for some reason. If you have had or are expecting to undergo an organ transplant, even immunosuppression for chemotherapy and that sort of thing, it's something that your doctor should work with you with. And also probably something that you can give him as a gift because he probably doesn't know about it. And that's part of our job, is to open Doc's eyes, I think. But it's also for other life forms. It's really interesting, talk about evolving scientists. David has his eyes on so many different pieces of ecosystem integrity. We talk about ecosystem, the globe, right? Mother Earth, Mama Gaia. He's interested in helping plants. I'm not saying we have clinical trials that say it helps your tomato plants work better, but go for it, try it, right? We certainly have lots of testimonials for animals. We have fantastic testimonials for the equine community, the horse, the horses and dogs and cats and all of our pets. I've been trying to convince my sister to put it on her gerbils. She hasn't done that yet. But anything that's alive is probably going to be helped by being in more alignment with all of the frequencies that life comes from, right?
It's so beautiful how you explain that. So how long can people expect before they notice something?
It's a good idea to have a pretty deep conversation with people that this is not a short-term fix, right? So you definitely want to give it a try, 60 to 90 days, sometimes more, for people who have been carrying around chronic issues that took a long time for them to get that way. And there is a lot of retracing to go. So the patches do work, the technologies work almost instantaneously. And not everybody feels X39 right away. Many do. A good chunk of people feel it within the first week or two, or first month. And we have some more poignant technologies as well. We have a patch called Ice Wave, which is fantastic for pain relief. And again, that capillary bed dynamic that I was mentioning before, this is not pulling back the pain response. It's not pulling back the inflammatory response. The beauty of this technology is it lets your body go with the flow, and that inflammation can actually finish the job that it's there for. And that's Ice Wave. I was up at an expo last weekend. I was a presenter and a vendor in Pennsylvania at this holistic expo, and probably 2 to 3 dozen breakthroughs on the spot. I probably had 100 or 200 conversations over the course of the weekend with people. Some wanted to try it. We used the phrase, Dr. Henrietta and I were fond of using the phrase, would you like to do an experiment? After we find out what they're up to, right? We had them fill out the health tracker form. Shoulders, ankles, knees. We had one lady with a headache with a pretty severe migraine who was going to leave, and we helped her feel great enough to stay the rest of the day. So some of them work they all work very quickly. It's not necessarily that you're going to notice it very quickly.
It's a really, really important distinction. So when they get close to the body, they're already working, but you may or may not notice X39 right away, like you said. give it 60 to 90 days. Ice Wave is more of what I call the short game, where you can get instant or rapid pain relief, which is pretty extraordinary. We actually had someone over at our house on Sunday who had a little teeny dog who's pretty much on its deathbed. And, she brought the bed and the diaper and everything. And Gregory put an X39 on Willie, and he starts running around and he's eating and he wants to go outside. And she's going, whoa, I haven't seen this dog in a while. So it can happen quickly, but give it time, because X39 is working on what's most important. Are you ready for some questions?
Sure thing.
We got a whole bunch of them, and please put your questions in the Q&A, and please thank you for symptoms only. And then we can, we want to stay very compliant. I'm not sure, Kat, what you're asking. So why don't you restate it with what your request is there? Because I'm not sure about that. Gina's having pain in hands, thumb joints, has been using Ice Wave for 3 weeks, wondering if she can wear it longer than 12 hours, and would carnosine assist with more rapid improvement?
We recommend that you keep real good track. I'm not trying to be flip when I say all of the technologies would bring extra improvement. Yeah. And I don't know if she's just using Ice Wave, but it's definitely time to integrate X39, because that's the mothership, right? Ice Wave, like Robin pointed to, is a great first start, but where there are deeper issues. And I like to tell people too, just because it's only your thumb that hurts, that just happens to be the joint that's throwing the tantrum. That same pathology is happening in every joint, right? And you may be somebody, Gina, who's got that condition. But when we put the body back into a place of repair, and it can mobilize the repair steroids, those hydrating tissues, the serum can bring the repair nutrients, the macronutrients, and all of the building blocks to the tissues. So it's important to stay really, really nicely hydrated, especially for joints. You can actually put right on the joint. I like to play with SP6, and we've been playing with triangles lately. You might want to change the position of the Ice Wave, just because you got relief the first time, the first couple of times, and it's a known quantity. Our brain kind of wants to say, keep doing that. That worked, right? But you can actually shake up the snow globe of the tissue, if you will, right? By altering the placements. So maybe reverse them, or maybe even try putting an SP6 right on the point of tenderness and bridging that, or creating a triangle with that, with the Ice Wave. And again, it's an experiment. You want to hold the tan patch. If you're only using the 2 patches, hold the tan right at the point of, and then use the clock method. It works in 15 to 30 seconds often. So you can move the white patch to the other side of the joint, or further away down the limb, etc.
It's beautiful. The other side of the joint, I've been practicing with that lately, having great success. I love it. PJ's got a SP6 question. For addiction, where's the best placement to not suppress the appetite, but is there another place other than stomach 36 that you would recommend?
Okay, it's a great question. It's a well-phrased question to be able to say, none of these patches turn anything off, right? Just like we said, the Ice Wave doesn't turn off the pain mechanism. It actually lets the body go with the flow of. And when you look on the website, it says helps appetite. It's not because it turns off the appetite. It actually puts the body in a place where it knows how to be satisfied, right? We overeat most of the time, and we're not even eating food when we're doing this, but all that junk that goes in our mouths and the overeating is because our body doesn't know how to stop. So all of a sudden, you put the body back into a place where it says, I have hormone balance, I have communication, my hormonal communications interest, organ to organ, are good. That's what SP6 is. But to answer the specific question, every patch is a total body activation. So it does work wherever you put it. And again, this is an opportunity for you to explore and keep very good track. You might want to take pictures as well. I've been suggesting to people lately to take pictures and measurements. I don't know if you have a swollen joint, you may even want to wrap a tape measure around the particular joint, if it's a knee or it's a whatever, and really, get to the place where you can give yourself some feedback on the progress that you're making. But the left side, the left side placements on the spleen meridian are in the booklet, in the usage booklet. And I actually like it right on the top of the foot in between the first and second toe too. That seems to work really nicely for me.
So what you're saying, and I think this is important for everyone, is try different locations. And if you're using the same location, mix it up a little bit, and see what you notice. Okay. Can any patches with skin rashes, can any patches probably help with skin rashes is probably the question.
Yeah, and the skin rash is probably a communication, right, to pay attention to. A lot of times we actually see an uptick in the thing when we start using these technologies, because the body all of a sudden has the capacity to start complaining about what it's been trying to say for quite a while, or clearing out what it's been trying to clear out for quite a while, or to react in a particular way. I would start very gently. And X39, which is the companion to X39, which is just new this year, is fantastic for skin and brain and bone density and muscle. And remember, the best muscle in the heart is the heart. So athletes are seeing beautiful endurance breakthroughs with X49. And that's our largest organ in the body, is the skin, of course. It's number one. You can't go wrong with X39 and X49. And I think if possibly she meant to say it, to ask, can the patches cause rashes? Again, it's not the patch that causes the rash, but the body's been trying to have a rash for a while, right? So this is just it's an experiment in revealing how we're living our lives, right? What are we interacting with that's toxic? It might be the air, it might be electromagnetic frequencies, it might be the food, the stuff that we pretend is food. And the body all of a sudden has a capacity to say, I'm going to do the right thing here. I'm going to say the right thing, which is the testimony to the environment that I live in, right? And which is the big game. All of a sudden you get a body that can communicate, and then it's time to start cleaning up lifestyle.
Mm-hmm. So we can go into lots of different directions with that one. Okay, well, thank you. Luis is wondering what patches would be useful to rebuild adrenal glands and help with all the electrical signaling throughout the body.
Yeah, we have a great nervous system patch called Eon. Again, undermarketed. You look on the website, it says it's for stress and anxiety. It's fantastic for neural integrity for brain and central nervous system. And probably not an accident that I intuitively started this by talking about the neuroelectric vascularity, right? And of course, the adrenal glands and the kidneys, so important to have healthy vascular tree. So you can actually put, I would try the energy enhancer right at the adrenals, tan on left, white on right. You might even try using it on one side only. That's where I would go. Yeah. In addition, again, X39 is the base, right? Once you've got a good 90 day to 6 month base, then your body's going to be in really great shape. It's not that these technologies won't work on the particular condition right off. It's not a bad idea to use them right off, but you will notice a more and more sensitive body, and you'll be able to navigate your own way, right? You get a better sense of discretion.
Thank you for saying that, because we recommend most everyone start with X39 for 60 to 90 days before other patches, unless you have any severe conditions. You're not sleeping or in severe pain, a procedure, an accident, a serious illness. But once you've had a lot more stem cells running through your body and activated copper peptide, everything else is going to work better. Okay, Shannon is wondering, his wife and son seem to struggle with absorption of water. They drink the appropriate amount, but it goes right through them. What might be causing this, and what might help?
Well, it's a total body salt issue. So vascular tree volume is dependent on all of our electrolytes. Or when I say salt, it's not sodium chloride, right? It's your calcium, your magnesium, your potassiums.
Minerals.
Minerals comes from real food. And to the extent that you can't hold on to water, that's, again, very good information that says your vascular tree total body salt is low. So you can, to cross over into some supplement conversation, you can't go wrong with a calcium, magnesium, zinc, and a real nice mineral formula. And once your body starts feeling that, then widening your food choices. But if it's a long-standing problem, especially if it's a young person, definitely take some blood work and have a doc take a look at it and see which. That'll give you a fingerprint, serum work of which electrolytes are low and or high in the urine versus the serum. But that almost always, whatever the template is, you're not getting enough of the real delivery of the real electrolytes from the real food, healthy food.
That's beautiful. And you keep mentioning food as medicine, and you're talking about expanding the variety also, because most of us have a pretty limited variety in our food choices, don't we?
Yeah.
Yeah.
I won't go too deeply into this, but it's worth saying, I think, glyphosate in the soil, which is the main poison that's taken down most of the crust of our earth right now, is an analog to glycine. And GHK copper peptide is dependent on bioavailability of glycine. And if all of a sudden there is an imposter in the body will use, it's not that that X39 won't work, but David was talking about glycine working, having to work harder to make itself available to that peptide complex, because glyphosate comes in and, like a bully in a schoolyard says, I'm going to play in this playground, but it can't do anything. It doesn't have any organic value. In fact, it's negative value. So glyphosate, for folks who don't know, is Roundup. That's the thing that's killing all the bacteria in the soil, which is why even a lot of quote good food choices don't come along with the proper nutrients. So it's really important to eat organic and move towards healthy, thriving food that came from happy soil.
Great. Are you up for staying a little longer? Because there's a lot of questions.
Sure.
We'll handle a few more. We probably won't get to all of them, but let's see. Michael wants to know, he's got some artery disease, and he wants to know the best place to patch X39 and if there's other patches that can help him decrease the pain. His vascular surgeon and I are going to place a number of stents in my legs this summer to help increase the flow of blood. Where would he put X39 and 49?
Yeah, and it's not my body, and it's not maybe my place to say. But first order of business is to have a conversation with the surgeon and say, are you willing to wait 6 months? It's a great procedure, and it's a very safe procedure, and 99% of the time it goes well. But there are downsides to every procedure. If he's willing to wait 6 months and watch with you, I would suggest you get a really good comprehensive blood work, take good pictures, before pictures. We'll get X39 and X49 on you. And again,
he wants to know where to put them.
Just in the suggested placements. It doesn't have to be targeted at the limbs. X39 and X49 both suggested right below C7, the bump on the back of the neck, and right below the belly button, a couple of finger widths.
That's really helpful for everyone to know that they activate and they go systemically. And so those recommended locations will reach every place. I put it here and a week later, my knee pain was gone. Yeah. Okay, Carmen, can someone doing hormone therapy use X39?
Oh yeah,
Great, great.
makes everything work better.
Okay. And Yolanda's asking, what's best for very high blood sugars, 250 plus? That's very high.
Drive past the golden arches, stop eating junk. The patches work only to the extent that our bodies are aligning with Mother Nature. And to the extent that we're toxic, and we're pouring in, SP6 is great, because it does, a lot of my work is functional medicine, is food as medicine intervention, is realistically, it's hard to change habits. And it takes 6 months to a year, and sometimes more, for people to make those changes. These technologies are not dependent on the current conveyor belt of the body. You chew and swallow something, it's got to be absorbed. So you have to have, a capable absorption. It's got to be mobilized to the target tissue. So you have to have capable vascularity. A lot of stuff that goes into, is this vitamin C that I'm swallowing actually going to help my toe, right? The cool thing about the patches is they're not dependent on that. Immediately confer competence to the tissue at hand, which doesn't take off the table the need to make those other lifestyle changes, right? The patches aren't going to save you forever. And if the body is trying to create disease inside, it's probably going to win at some point. So SP6 is great as a first order of business. X39, of course, supports and accelerates SP6. And then you can stop eating junk.
Yeah, we have to do our part.
Yeah.
The patches do amazing things, but it's a lifestyle choices. And I love how David Schmidt constantly reminds us, what we eat, the air we breathe, the water we drink, the movement, the sleep, and taking care of ourselves it can make a huge difference. Okay, Angela, do you have any recommendation for where to start patching for a young adult under 20 dealing with unwanted thoughts or fears leading to undesirable behaviors, often repetitive behaviors that can interfere with daily activities, causing distress? Very well stated, Angela.
Yeah, very
Good
great.
job. Good job.
There's a lot in there, and
A lot.
we live in such a complicated place. I was actually just reading about how a lot of the mask interventions, they're actually looking at language. What did they call them? Flips in language, conversational turns, and kids' ability to go with the flow, so to speak, right? And in a young child, that's an indicator of cognitive growth. We're seeing downturns in mood, and we're seeing downturns in cognitive ability, and we're seeing word finding problems. It's not an accident, right? We took what was supposed to be a thriving throng of kids on the playground, and we stuck them away from Mother Nature. So we're in trouble here. And the first order of business is take the mask off. Again, we do have very nice immediate conferring of competence. It's not gonna take off the table the underlying issue, which is probably a food issue. And I promise you, the young person was not born with attention issues and was not born with anxiety, right? That's an acquired condition. And the good news is it's a very reversible condition. Attention issues are reversible. And mood and personality issues are reversible and recoverable. A really nice thing to do, because we've learned also to not breathe. You can put the energy enhancer right at the lung points. So you might want to try energy enhancer just at the periphery of the collarbone, of the hollow is the word I'm looking for. I'm having my own word finding difficulties. So it's just under the collarbone, right at the pectoral insertion. You could put the energy enhancer there and an Eon right on the sternum. You can also put a carnosine right on the sternum. And carnosine is incredibly stable as much as it activates muscle tone. And it's actually a really nice partner for Eon. Eon balances the nervous system. So it helps us come back to center from those hits that we take. And so that might be a nice way to go.
Beautiful. Thank you. Thank you. Thank you. I wanted to share a quick story from Gina. She said, my husband's not necessarily as passionate about this product as I am. I had a very serious headache over the weekend and I placed the ice wave on his, on his temples, and his headache disappeared within a half hour. He's more of a believer now, isn't he? Okay. Let's see. Kat is saying, and let's just do this one last one because we're running long tonight, but thank you so much for taking the time, Dr. Tom. Closed head brain injuries are suffered by military who've been exposed to repeated explosions on duty. It causes lingering brain fog, depression, memory loss, emotional highs and lows. What would you recommend?
David's work on X39 and the clinical success on X49 was amazing, is amazing. And we will continue to be surprised, I think, with brain recovery. But X39, X49 together is always the answer. Eon is fantastic for mood, anxiety, nerves, and again, the underlying condition there is stop war and stop the explosions in the first place.
Yeah.
That for a way to end.
Yeah, I know.
That's what we're doing here.
That's what we're doing here. We're doing that. So we've gone a little over, like quite a bit. And thank you, Dr. Tom, so much for giving us so much of your time. And thank you all for these amazing contributions tonight. If you want to make sure we get to your questions, put them in early in the Q&A, and please make sure it's symptoms only. For those of you that mentioned disease states, I won't touch them. So just know that. Just know that. And I want to thank everyone for joining us this evening. Many of you are new and here for the first time, and we recommend that you get back to the person that invited you and get started. The product comes with a 30-day risk-free guarantee. We have a wonderful customer program. If you like to share, there's a very generous compensation for that. And we need your voice. We need people sharing this because most people don't know it exists, and it's safe, it's natural, it's affordable, and more importantly, it works. And it's a wonderful thing to wake up every day and get to hear miracle stories. Isn't it, Dr. Tom?
That's the best part of the work.
It's just, it makes it more fun than anything. So thank you everyone for joining us. Thank you, Gregory, for your wonderful presentation as always. And we're going to say good night. So bye everybody. Thank you.